Regulon tablets is a monophasic oral contraceptive. Active ingredients: Desogestrel, Ethinylestradiol. The main contraceptive action is to inhibit the synthesis of gonadotropins and suppress ovulation. In addition, by increasing the viscosity of several mucus, the movement of spermatozoa through the cervical canal slows down, and it changes the state of the endometrium prevents the implantation of a fertilized egg. Ethinylestradiol is a synthetic analog of endogenous estradiol. Desogestrel has a pronounced gestogenic and anti-estrogenic effect, similar to endogenous progesterone, with androgenic and anabolic activity. When taking the drug, the loss of menstrual blood is significantly reduces. With initial menorrhagia, the menstrual cycle is normalized, and a beneficial effect of the skin is noted, especially in the presence of acne vulgaris. How to use? The drug is prescribed 1 tablet per day, if possible at the same time, starting from day 1 of the menstrual cycle for 21 days. This is followed by a 7-day break, during which menstrual-like bleeding occurs. Then the pills from the next pack are resumed, even if the bleeding has not stopped yet. Subject to the rules of admission, the contraceptive effect is maintained for the duration of the 7-day break. If the first tablet is taken on the first day of the menstrual cycle, then additional methods of contraception are not required. You can start taking pills from the 2nd to 5th day of menstruation, but in the case in the first cycle, additional method of contraception should be used in the first 7 days of taking the pills. If more than 5 days have passed since the start of menstruation, you should postpone the start of taking the drug until the next menstruation. After childbirth for non-nursing women, the drug can be prescribed after 21 days. In this case, there is no need to use other methods of contraception. If the drug is prescribed later than 21 days after delivery, then additional method of contraception must be used in the first 7 days of administration. If in the postpartum period sexual intercourse preceded oral contraception, taking the pills must be waited until the first menstruation appears. In women who continue breastfeeding, the use of combined oral contraceptives is not recommended, since taking the drug can reduce milk flow. After an abortion, it is recommended to start taking the drug immediately after the operation, in which case there is no need to use additional methods of contraception. When switching to Regulon after taking another estrogen, progestin, hormonal contraceptive, the first Regulon tablet should be taken in the next day after completing the course of the previous drug. There is no need to use additional methods of contraception. When switching to Regulon after taking another hormonal contraceptive containing only gestogen, the first Regulon tablet should be taken on the first day of the menstrual cycle. There is no need to use additional method of contraception. If menstruation does not occur when taking the previous drug, you can start taking Regulon on any day of the cycle, but in this case, additional method of contraception must be used in the first 7 days of admission. As additional method of contraception, the use of cervical cup with spermicidal gel, a condom, or abstinence from sexual intercourse is recommended. The use of the calendar method as an additional method of contraception is not recommended. If it is necessary to delay menstruation, the tablet should be continued without a 7-day break. In this case, intermenstrual bleeding may occur, but this does not reduce the contraceptive effect of the drug. Regular intake of Regulon can be restored after the usual 7-day break. In case of missing a dose of the drug, if the delay in taking the pill was no more than 12 hours, then you need to take the missed pill and then continue taking it at the usual time. If the delay in taking the pill was no more than 12 hours, this is considered a missed pill. The reliability of contraception in the cycle is not guaranteed, and the use of additional method of contraception is recommended. When skipping 1 tablet in the first or second week of the cycle, you need to take 2 tablets the next day and then continue regular intake using additional methods of contraception until the end of the cycle. When skipping 1 tablet in the 3rd week of the cycle, in addition to the above measures, a 7-day break is excluded. If vomiting or diarrhea occurs after taking the drug, the absorption of the drug may be incomplete. If the symptoms have stopped within 12 hours, then you need to take another 1 tablet additionally. After that, you should continue taking the tablet in the usual way. If symptoms persist for more than 12 hours, then additional methods of contraception should be used for the next 7 days. Contraindications. In the presence of severe and/or multiple risk factors for venous or arterial thrombosis. The presence or indication in the anamnesis or the precursors of thrombosis, including transient ischemic attack, angina pectoris, migraine with focal neurological symptoms, including history, venous or arterial thrombosis, thromboembolism, including myocardial infarction, stroke, deep vein thrombosis of the lower leg, pulmonary embolism, at present or in history. The presence of venous thromboembolism in history, diabetes mellitus with angiopathy, pancreatitis, including history, accompanied by severe hypertriglyceridemia, dyslipidemia, severe liver disease, cholestatic jaundice, including during pregnancy, hepatitis, including history, before the normalization of functional and laboratory parameters and within 3 months after their normalization, jaundice when taking GCS, cholelithiasis in present or in history, Gilbert syndrome, Dubin-Johnson syndrome, Rotor syndrome, tumors of the liver, including history, severe itching, atherosclerosis or its progression during a previous pregnancy or taking corticosteroids, hormone-dependent malignant pneumoplasms of the genital organs and mammary glands, including if they are suspected, vaginal bleeding of unknown etiology, smoking over the age of 35, more than 15 cigarettes per day, pregnancy or suspicion of it, lactation period, hypersensitivity to the components of the drug, Use during pregnancy and lactation. Regulon is contraindicated for use during pregnancy. Regulon should be discontinued 3 months before the planned pregnancy. In the event of pregnancy, the drug should be discontinued. The use of Regulon is contraindicated during lactation, breastfeeding, because it reduces the excretion of breast milk, changes its composition. In addition, active substances are excreted in small amounts in breast milk. Special instructions. Before starting the use of the drug, it is necessary to conduct a general medical, detailed family and personal history, measurement of blood pressure, laboratory tests, and gynecological examination, including examination of the mammary glands, pelvic organs, cytological analysis of a cervical smear. A similar study during the period of taking the drug is carried out regularly, every 6 months. The effectiveness of the drug Regulon is reduced in case of missed tablets with vomiting and diarrhea, as well as when taken with other drugs. Pregnancy poses a greater risk of thrombosis than taking hormonal contraceptives. Side effects. Side effects requiring discontinuation of the drug. From the side of the cardiovascular system, arterial hypertension, rarely arterial and venous thromboembolism, including myocardial infarction, stroke, deep vein thrombosis of the lower extremities, pulmonary embolism, very rarely arterial or venous thromboembolism of the hepatic, mesenteric, renal, retinal arteries and veins. From the senses, hearing loss due to atherosclerosis. Others, hemolytic uremic syndrome, porphyria, rarely exacerbation of reactive systemic lupus erythematosus, very rarely symptoms career, passing after discontinuation of the drug. Other side effects that are more common but less severe. The expediency of continuing the use of the drug is decided individually after consultation with a doctor based on the benefit-risk ratio. On the part of the reproductive system, acyclic bleeding, bloody discharge from the vagina, amenorrhea after discontinuation of the drug, changes in the state of vaginal mucus, the development of inflammatory processes in the vagina, candidiasis, tension, pain, enlargement of the mammary glands, galactorrhea. From the digestive system, nausea, vomiting, Crohn's disease, ulcerative colitis, the occurrence or exacerbation of jaundice and/or itching associated with cholestasis, cholelithiasis, dermatological reactions, erythemanodism, erythema-exudative, rash, chloasma. From the side of the central nervous system, headache, migraine, motility, depression. On the part of the organ of vision, increased sensitivity of the cornea when wearing contact lenses. On the part of metabolism, fluid retention in the body, change increase in body weight, decreased tolerance to carbohydrates. Other allergic reactions.